right, good morning, everybody. I love this time of year, and also it makes me sad because it starts reminding all of us that we're going to say goodbye to two of the residents that have been here for 7 years. And we're going to be congratulating Dave Bass and Mike Meyer. And Dave Bass is going first by way of introduction. Of course, we know both of you very well, but I am just going to go through the litany of your lineage. So I apologize to you, David and Mike, but you have to listen to it again. David was born in an alligator farm in Florida, and had sort of a meteoric academic career in that he went to started off with an Ivy League school, went to Cornell University, and got a Bachelor of Arts in psychology. And for all of you who don't know, that was the precursor to the neurosciences degree. Neuroscience is now the second most popular degree, I think, at the University of Washington after psychology. So he then matriculated at Emory University, where he earned his MD and his PhD in the MST program. He earned a Ruth L. Kirschstein National Research Service Award. And one of his interesting, he has some very interesting papers on the role of the amygdala modulating control of muscle tone. And then he studied the bird song nuclei for song discrimination. So clearly had some interesting intellectual pursuits. And he went on to be at the University of Washington, where he published over 25 peer-reviewed papers. And we're going to be very proud of him as he graduates from our program. This is where I tell both of you, I can always hurt you more, but I cannot stop the clock now. And so and that was a phrase that I used for my residency graduation when I got this far into it. So Dave's going to go off to the Brigham and do an endovascular vascular fellowship, and we're going to be very proud of David. So without further ado, David, tell us about what you learned in the 7 years here, if you can, in 20 minutes or 30 minutes.
All right. Thank you, sir, for that extended introduction there. Hopefully everyone can see my slides at this point. So yeah, thank you for the opportunity to talk in front of everyone. It's kind of crazy to be at this point in residency. And before I get started or too far into the talk, I know that sometimes my personality can come off as a little flippant, so I just want to make a couple things clear. Number one, this talk isn't meant to offend anyone. And if it does, don't worry. I actually have a meeting scheduled with Dr. Ellenbogen after this to, and I quote, discuss perhaps changing some of your approach and stylistic flourishes that are not working. Sir, I'm looking forward to that meeting. So thank you. And this may also be a good time to thank Dr. Coe and Dr. Levitt for handling some of the more colorful paperwork. And then kind of along those lines, the second point is that just because I laugh or joke about something, that doesn't mean that I don't take it seriously or that it's not profoundly meaningful or important to me. So anyway, I got the name for this talk when I was joking around with the major. We were joking about how crazy it is that, we haven't even graduated residency yet here we are, expected to give this talk on neurosurgery in front of an audience of people who literally wrote the book on neurosurgery. Like, we have attendings like Dr. Shaker performing these crazy complex bypasses. We have Dr. Ferreira pulling tumors the size of grapefruits off of people's brain stems. And yet I haven't, what have I done? How do I follow up this book on neurological surgery with a talk called The Next Chapter, or maybe even the final chapter? I don't know. But all joking aside, I'm incredibly thankful to have had the privilege to study under so many great minds in the field. The truth is, it's just not possible in 20 minutes to appropriately thank everyone who's had a profound impact on my training for the better part of the decade. But I do want to take a few minutes to thank a few people. So Dr. Ellenbogen, thank you for taking me under your wings so many years ago to bring me all the way out here to Seattle to train at the University of Washington. Thank you to my mentors in cerebrovascular surgery, Drs. Kim and Levitt, for assisting me in achieving my career goals, like securing a spot for fellowship. And Dr. Levitt in particular has been a formative research mentor. Dr. Zhang, I really appreciate the effort and patience you've put into teaching me since I was your trauma junior so many years ago. And then Dr. Houtman, thank you for inviting me and other members of the tribe into your home for the Jewish holidays. You always made us feel like we had a place to go, even though we were so far away from home. So with that, let's have a little fun. We're all familiar with some of the sagely advice found in many of our departmental aphorisms, right? Same way every time, fast on the straightaways, slow around the curves, and my personal favorite, don't F it up. But for the sake of my juniors, I thought it would actually be a little bit more helpful to focus on some of the more personal feedback I've received in my tenure here, and to discuss some of the hidden pearls within these little gems. So to start, that's why this is a 7-year residency, but some people take 8. Love to spend more time with you too, sir. And Zach, I'm sorry, don't mean to roast you here, but that picture was too perfect for this quote, so I had to throw it up. Anyway, I think the learning point here may be a little trite at this point, but I suppose it bears repeating again. Neurosurgery training is really hard. It's not for the faint of heart. It demands relentless dedication to the craft. And if it's what you want to do, then you got to expect to work long, grueling hours in a high stakes environment with little tolerance for error. You really have to hit the ground running from day one, because catching up is exceptionally more difficult than keeping. Ask me how I know. So the point here is there's a lot to learn, so buckle up. All right. What's going on inside your head? Brownie in motion? Well, sir, I wish I were that organized. Yeah, the point here, I suppose, is clear. You have to stay organized. There's a ton of information coming at you from many different directions, and it's your responsibility to construct this into a coherent framework that you can act upon and communicate clearly to others around you. The residents who work with me most frequently are probably tired of hearing this and hearing me harp on it, but many of the preventable errors, if not most, that we cause in healthcare can be reduced down to failures in clear communication. This is something that's particularly important to me and something that I work on improving every day. I am so sad that you are my chief resident. That makes 2 of us, sir. Not sure what the learning point here is. Maybe it's just do better or don't suck. Regardless, I thought it was a great zinger, and it segues nicely into the next point. It's my fault. I always trust you guys, and you guys always let me down. So technically, this was actually said to one of my co-residents, but given that I rotated with the attending just prior, I feel entitled to claim some of the credit on this one. Dare I say, I'm the reason this attending should have known better. But the learning point here is that as a neurosurgeon, you have to take responsibility to make things happen. Your goal isn't to shirk off responsibility or blame others. You're the patient's doctor. It's on you. They and their families are depending on you getting them to tomorrow. For our juniors, this means taking responsibility for what happens on your watch, for what does and doesn't happen in the ED, the ICU, our floors. It's just make it happen or keep it from happening if it's not going to help the patient. For my fellow chiefs, this means taking responsibility for your juniors' mistakes. Teach them all you know and set them up for success. I mean, this is what our attendings have been doing, right? They let us operate on their tab and take responsibility for our flops. And kind of along those lines, like as you grow, and mature, you're going to end up being the end of the line here and being the one who is responsible, kind of like our attendings, for learning or for taking the responsibility. I was recently told, be alert just because someone else makes a move. If it doesn't make sense, follow up and use your head. So, yeah. And that brings me to the next point. This approach, it's a C- at best. I found this to be a very good reminder that no matter how far you think you've come, there's always going to be more you can improve upon. If you have a slow day on your service, then use it as an opportunity to jump in on a case with another service. You know, even over a stretch as long as 7 years, there's only a finite number of opportunity to learn from the experts before you graduate, so take advantage of it. I mean, I've even found it useful to jump in with my classmate, the major, to see what he's learned along the way and to see what I could learn from him. These were honestly some of my favorite days in residency. And then finally, don't listen to the voice inside your head. Listen to the voice outside your head. That's the voice telling you the right thing to do. So this is probably my favorite, but the point here is if you're going to learn, you got to listen, especially to the experts. Now, for some of us, the first step is actually going to be to stop talking because it's very difficult to listen while you're talking. But at the end of the day, we all have to listen. We all have to learn to course correct. You have to be coachable. And this means letting your pride go by the wayside and internalizing critical feedback in a productive manner, even when it's difficult to hear. I mean, that's what I've been trying to demonstrate through this whole presentation, right? Is that not all these comments were necessarily the easiest to hear, but they all had really good points and things that I was internalizing to try to make me better every day of residency. And this is something that I hope my juniors are able to do. In fact, I know that many of them can do this very well. I've worked most closely with Malia and Julian, and I can honestly say that they've done a wonderful job. I'm very proud of how far they've come since I first met them and how they've continued to develop and mature throughout their training. But all that being said, sometimes it's actually the voice that's inside your head. That's exactly what you need to listen to. Neurosurgery residency is hard. They say pressure makes diamonds, but we've all seen pressure crush skulls and snap necks. Our training, especially early on, can be incredibly dehumanizing. Everything and everyone, no matter how big or how small, gets reduced down to just a list of checkboxes. And you're constantly inundated with demands pulling you in a multitude of different directions. And you just struggle to survive, and it becomes so easy to forget who you are at the core of your being. Now, I've been incredibly fortunate in that I have a family that supported me through some of the toughest days. They've helped me find my bearings when I've gotten lost, and they've reminded me of the person I want to be when I forget. In particular, my brother Eric has profoundly shaped my perspective on my career. He was born 15 months after me, but even though he was my younger brother, he was the one leading me into mischief. As you can see here, him diving face first into the cake. Much like myself, he was born in the 80s, but I'm not sure if he ever actually left the decade. He loved all the music from Bruce Springsteen to Motley Crue, AC/DC to the Eagles. And for those of you born in the 90s, I've provided a reference photo up here in the upper right of a gentleman wearing traditional garb from the decade. This is Kurt Russell, and it's actually from a movie that came out the year he was born. You know, you can't really summarize someone's personality in a 20-minute PowerPoint presentation via Zoom. But if I were to try, it's to say that he's always a kid at heart. He's the funniest person I ever knew, and he never took himself seriously. If anything, his business was making people laugh and making people around them feel good about themselves. He was always pulling shenanigans, and yeah, it was like during my med school graduation, he snagged my med school diploma and ran around telling everyone that he got one of these medical degrees in just a day and that it couldn't have been any easier. But he was the best brother you could ask for. We traveled the globe together, did all sorts of crazy things. We went scuba diving with my youngest brother off the coast of South Africa with the great whites. Didn't end up using this guy for chum, but that's all right. We went bungee jumping up in the Dengie rainforest up in northeastern Australia, heli skiing and Telluride, skiing in Whistler, and then we hiked all sorts of crazy stuff like Mount Washington up in New Hampshire, Blood Mountain down in Georgia, up to Summit Lake right here in the shadow of Rainier. But he wasn't just a great brother. Everybody considers him their best friend. And this was because he had this amazing way of walking into a room and making you feel like you're the most important person in the room. He just has one of these magnetic personalities. So I was super thrilled for him when one day he met a girl that captured his attention, a beautiful young woman from Long Island. And he actually brought her out here a handful of times to meet me and hang out with me. And those are some of certainly my favorite trips out here. And he soon realized that this was the girl for him and ended up proposing to her in December of 2019. Now, this was very uncharacteristic for him and for many reasons, not the least of which was that he actually planned this out. He had both families lying in wait in a restaurant to surprise the couple when they came to celebrate. I'd actually flown into New York City just for the evening to be a part of this. And I remember, I'll never forget him walking into the room, all smiles and laughter, coming up and hugging me and being like, you know, you're my best man, right? And just that kind of magnetic way that he had about him. And before long, you know, later that summer, I was back on a plane, heading back out to New York in preparation for his wedding. Fortunately, this time I was able to come out a couple days early. And we spent that first evening hanging out on his balcony in Astoria, overlooking Lower Manhattan, beautiful summer sunset, talking about the deepest things in life that like brothers should before one goes into a wedding, and split it and doing this over a bottle of High West and a few Modelos. The next morning we do our usual routine where we wake up, kind of shake off the hangover and get a workout in. We tried running up the East River, and I remember he's like, 10 miles? You want to do 10 miles? 12 miles maybe? And I'm like, dude, residency hasn't been treating me that well. We're going to be lucky if I get to 3 miles. So anyway, we did the run and packed our bags, jumped on the LIE, and made it off to the rehearsal dinner to join a few close friends and a family who were able to fly in. Even Granny B was able to fly in for the dinner. And yeah, had a wonderful evening with close friends and family. But that was it. The next morning, he never woke up. And instantly it was all over.
What?
Not just his hopes and dreams, or not just the wedding, but his hopes and dreams. I lost my brother overnight, and my parents had lost their son. The family my sister-in-law had been dreaming of had suddenly disappeared. The finality of losing him has been incomprehensible. Like, I'd never considered whether I'd live to see the final chapter of his life or even what it might look like. But I can't help but wonder what the next chapter was supposed to be. Since losing my brother, a number of people in our department have come up and shared their own stories of losing their loved ones with me. And I know still others have more recently experienced their own loss. Each passing has been tragic, and each of us has been left behind to endure our own journey through grief. But this talk isn't about loss or grief. No, guys, the point I'm trying to make here is don't go to bed angry. Take a page from Eric's book and care about the people around you. Hell, take a deep breath and remember that behind that endless list of check boxes, there's human beings. There's somebody's loved ones. But mostly, figure out whatever it is that brings meaning to your life and chase it down, because tomorrow is not a guarantee. Now I've been fortunate in that I've met someone that gives my life a whole new depth and meaning. She's been a pillar, or my pillar of strength throughout all of this. So despite the tragedy, I'm actually excited for what happens next. I love my family, and I am so thankful for their support throughout my life. They've been here with me through thick and thin. And they're the reason I've made it this far. They're what means most to me in life. Nothing means more. And in a few short weeks, Christina and I are going to be moving across the country to Boston. And I'll tell you what, we're looking forward to being a bit closer to family as we start the next chapter in our lives. So that's it.
I think we just take a moment to think about what you said. Because yeah, I think we're speechless. Thank you, David, for opening your heart. Moment of silence. All right, so David, do you mind if we go on to Michael's?
Absolutely. Please do.
I will.
Thank you guys.
I can assure you that will be one of the most memorable talks you will all ever hear. Okay. Major Raymond Michael Meyer is a young man that grew up in the Valley of California, loving all the fun things you can do, from fishing to hunting to hiking, and he was appointed by his congressman to the United States Military Academy in West Point, where he excelled and went off to become an officer in the United States Army. Being as intellectually capable and superior that he is, he went to the smartest part of the Army, which is the Corps of Engineers. And he served in the 43rd Combat Engineering Company, which has existed since World War I. And they are the sappers, they are the combat engineers that support cavalry or infantry regiment, brigade. And he went off after doing what he did. He went off and he earned a Bronze Star, which is an award you can only win in war, for his courage and his service to his fellow soldiers. And he went to USHUS for his medical school, where he was the valedictorian. And he has been here and like David, served this department and the patients in this department for 7 years, published over 20 peer-reviewed papers. Mike always says to me, I don't do funny, and by just saying that, he cracks me up all the time. Although he likes you to think he is always serious, he is serious, but also a lot of fun, and he's very supportive of his fellow residents, as you can see. So without further ado, Major, thank you for your service, of course. And John David Lozier, also a serviceman, asked how long he'll be in the Army, and he will have served our country over 20 years when he completes his obligation for all the extra years he added on. He is going to be doing a fellowship here at the University of Washington in endovascular, and then go off to Madigan to serve the soldiers, sailors, and airmen of the United States military. So, Mike, you want to tell us your story?
Yes, thank you, sir. Okay. Megan probably noticed I never replied to her email with the name of my talk because I couldn't come up with a creative one. This is my chief talk. So I'm gonna start with talking about me and my family. So first, I'd like to talk about my wife Danielle. She's a accomplished and amazing person. She was put up with a lot of things since she met me, and I thank her for that. Not least of which is she is a willing and I think a happy participant in my greatest obsession outside of work. You'll see comparing this slide to the next one, what the general genre of the only photos I have on my phone are. These are all pictures of Danielle or me and Danielle or our friends and Danielle fishing all over the world, which I think she likes to do, but she does mostly because I like it. This is her, I think, personal best favorite fish, which is an almost 50-pound mahi-mahi or dorado. Uh, this is the rest of the family. So my parents right here and here, my sister and her husband, Jamette and Bryant. My parents' names are Bonnie and Mike. And there are my sister's three kids, Emmett, Nolan, and Asher. And then my wife's family, Steve and Sue. And then my grandmother and some of my Aunt Jamette and some extended family here. My grandmother passed away during my third year of residency, but was an amazing person and healthy until she was over 90, and then pretty quickly passed away, which is something we can all hope happens to us, I think. And then these are my dogs, Cinco and Price. Cinco is the brown one, Price is the black and white one. Yes, I just think these are good pictures. I don't have a lot more to say. So Dr. Ellenbogen and David both brought up that I'm in the Army. So the Army tries to distill your entire life into this one document called the Officer Record Brief or Enlisted Record Brief. So I'm just going to use it as a way to talk about where I came from. So I was born in Southern California, says that here. Moved a little bit north, but stayed in Southern California through childhood. And then when I was 18, I went to West Point where I studied engineering, says that here. And then after that, while I was at West Point, I met Danielle and we got married, says that somewhere, says that here, right when I graduated. I went to Fort Hood, Texas, where I joined the 43rd Engineer Company, which was part of the 3rd Cavalry Regiment. And was in that unit for about 4 years. We deployed to Iraq for a year, a little over a year of that, says that up here. And while I was there, I was at the point where usually about 3.5, 4 years into the Army where someone has to decide, are they going to continue a career as a line officer or are they going to do something different, get out of the Army, change specialties in the Army, whatever it is. And I decided I wanted to go into medicine. So I, studied for the MCAT and did my applications, while I was there in Iraq. And took the MCAT about 2 weeks after getting back, and miraculously did okay on that. And got into the Uniformed Services University, which is right here, and studied medicine. Decided pretty early I wanted to go into neurosurgery, and that's where I am now. And then we'll hopefully be moving on to stay in the area and practice at Madigan, and which is down at the base in Tacoma, and stay affiliated with the department afterwards. The reason I joined the military, to talk about this for a minute, is my grandfather, Raymond Michael Meyer II, so I'm named after him. He was in the Navy in World War II. It's kind of peculiar to some people that I chose to join the Army, but it all started by hearing stories from him of his time in the Navy. I think many of you have probably seen the movie We Were Soldiers with Mel Gibson. In that movie, there's a pretty memorable scene where taxi drivers are delivering Western Union telegrams to families of people that were injured or wounded. That's actually a real thing. This is a Western Union telegraph that my, I guess, great grandmother got that says, "We deeply regret to inform you that your son was injured." And the kind of craziest part of this is that the extent of wounds is not now available, and the delay in the receipt of these details must necessarily be expected. So for some amount of time, I don't know exactly how long, his parents didn't know how badly hurt he was and that he may be dead. They didn't know, but fortunately he wasn't. And he made a great recovery and lived for a long time. His worst injury was to his right hand, right here. And a Navy orthopedic surgeon did what at the time was a very novel repair, which was an alternative to amputation. And his hand was in a fixed hook position, but he got to keep it for the rest of his life. And then this is all of his medals and the flag that he was buried with. So I'm going to switch gears now and give some advice to the residents. So junior residents, this is probably the most important piece of advice I have for you. Do as many cases as you can, and that is not going to happen on its own in your junior residency. There's not a huge amount of protected, you have nothing to do but an OR case today time. I know you all know that. But there is plenty of time to do cases if you make sure that you prioritize it. And it's going to be real hard to make up for the lost time if you find yourself as a mid-level resident and you didn't get in the OR to learn the basics. Not a good time as a R4 to learn how to suture effectively and how to handle instruments and good sterile technique. It's a great time when you're an intern off service and you leave neurology clinic at 3 p.m. or whatever, or you're an R2 in your post call. And I know we're supposed to stay within at work hours and all that, but you know, whatever, you got to get to the OR and you're going to learn that way. Many of you are good about it. And I think that we just need to remember to tell everyone in every class that comes after us that the only way they're going to get this experience is if they make it happen on their own. And then next one, junior residency is a finite amount of time. You just need to work really hard until it's over. And then once you're a senior resident, you know, even our 3-year, but certainly our 4-year and after, it's way more enjoyable. Most days are not exhausting and miserable work and consults for tiny traumatic subarachnoid hemorrhages you can't even see. Most days are great cases and still exhausting, but you're not angry about any of it at the end. All you have to do is make it there, and it will happen. Every year it's either 365 or 366 days long. I have a little collage that's an analogy for this. So these fish are called jacks. Some of them are almaco jacks. Some of them are yellowtail amberjack. These fish are very strong, but fortunately they will bite very heavy leader because they're kind of stupid. So if you hook one and your gear was selected properly, all you have to do is hang on really hard for about 5 minutes and maybe 15, and the fish is going to tire out and you're going to land it, but you have to make it there. And if you let the fish pull drag, you're going to lose. And instead of 15 minutes to glory, you have 1 minute to failure. And I think that's similar to residency. You just got to keep your head down and keep working. Junior residency comes down to grit, pattern recognition, and basic preparation. Basic preparation, what do I mean? It means you got to have a reasonable knowledge base. You have to have paid attention to the things that came before, the patients you've seen before, the things you were told before, how you are supposed to do procedures, how you're supposed to keep track of the data for your patients and write it down on your list, whatever. But it's not, you know, incredible and elaborate reading a book chapter every day for every procedure that you're going to scrub into close. That's great if you can do that, but that's not what I mean. I just mean basic stuff. So if you have the grit and recognize patterns and you did the very basic preparation, you're going to be successful. These are all different species of tuna. They always do the same thing. It's always the same pattern. They eat, they run, they get tired after some amount of time, depends on the size of the fish, and then they just swim in circles, usually clockwise, and you slowly reel them in. And as long as your preparation was good, which you pretty much means selecting the right tackle and tying a good knot, you're usually going to win. And if you don't, it was one you weren't really destined to win, and that's okay, which is kind of like the mistakes you're inevitably going to make as a junior resident. If you did everything you could do, you know, a mistake's not great, but at least you did everything you can do, and you're accountable for it, but you're not a failure for it. And then finally, try not to lose your temper. I put this in the junior category, but this goes for all levels. Anyway, senior residents. So this is another one I could say about any level, but I think senior residency is a good time to think about it. Relationships with the other people in the hospital are very important and they're hard to fix. I chose to talk about this at the senior resident level because my observation has been that if you haven't kind of figured this out by the time you're an R3 or an R4 and you're in the room every day working with OR staff and interacting with anesthesia, if you haven't figured this out by then and you kind of get a reputation for being difficult or dishonest, or not necessarily dishonest, but not, totally accurate in your estimates of time for how long things are going to take or whatever, you're not going to fix it by the time you're a chief, and then it's going to be a real problem for you. So keep that in mind, and you don't have to do anything amazing. Just be considerate of people and do the best you can to be accurate. And then finally, for the senior residents, take advantage of the opportunity. This is the only time in the residency where most of the time, the only responsibility you have for that day is the case you're in. As a chief resident, you're in the OR every day doing cases, but you also have patients, many of whom are going to have unsorted issues at the end of rounds for the day that you have to keep track of. You're going to have to make decisions based on images that a junior resident's coming in to show you and an exam that they're relaying to you. And it's kind of a lot of things. As an R4, more often than not, you have your case, and that's a rare opportunity. Make the most of it. This is a stretch, but I wanted to show these pictures. So halibut are a fish of opportunity, the hardest fish and the easiest fish to catch. If the opportunity is right, meaning you have a good place and the tide is slow enough and the sea is calm enough, you're going to catch them, and they're kind of stupid and they'll eat a massive hook with heavy leader. But if the current's fast or the weather's bad or you didn't pick a good spot, you'll never catch one. Not really a great analogy, but anyway. And then finally, for the chief residents, I think that this is one a lot of people are reluctant to do, including me, but I've tried to do it in the last year or so. Ask the faculty why they do what they do or why they just did what they did. When they do a move or they choose to do something or stop what they're doing and ask for the x-ray to come in to take a shot when they didn't do that at every other level, there's some reason, and it's not always intuitive to us. And I would just ask them. Very rarely have they been annoyed with me when I do that. Sometimes they don't really fully explain it, but usually they do. And I've learned a lot from that. And then next, pay attention to the first thing that the faculty do when they take over from you. Common scenario that this has been for me is if I'm working under the microscope and I get to a point where one of the faculty are going to take over, I look and I see they change the angle, they change the place they're dissecting. They don't use the instrument I was using. And I just pay attention to that. And I've actually learned as much from that as I have from actually asking questions. Then every surgery comes down to some fundamental things that we all have learned to do along the way. I know there's probably some exceptions to this, but most procedures come down to some fundamental principles. And no matter how big and complicated the deformity surgery or the skull-base tumor or the AVM seems, it's all those principles put together in some order and just done well. And you just have to figure out which ones they are. That includes when something bad happens, like bleeding, signal change, when we're doing a tumor or a spine case or whatever. And you just got to do those and I think more often than not, those fundamental things are going to serve you well. This is my favorite fish in the world. It's called the Pacific Cubera snapper, or in Spanish, Pargo denton. This is a fish that teaches the lesson of fundamentals. These fish were all shot in a cave, free diving, breath hold spearfishing in a cave in somewhere between 30 and 60 feet of water. And that's very intimidating. And for many years, I never got one, even though I was obsessed with it, because it seemed like an insurmountable risk. But it really isn't. You just pick a place that you can safely dive the depth, and you pick a day with good water clarity and conditions. You breathe up with discipline, and you go down and you place a shot somewhere good, and you're going to get the fish, and your fundamentals will serve you well. Another stretch, but I wanted to show the picture. And then finally, our faculty have a lot of particularities about how they do things in the OR, or how they manage their patients, data they want to hear and not hear in the mornings when you're talking to them. And the truth is most of that stuff is for a really, really good reason. Occasionally it may be random or just a preference, but the truth is we don't know which ones are which. When I was more junior, I kind of thought that it was just, personalities and people were, particular about the things they cared about. But I've learned that there is a really good reason for almost every one of them. And by the time you know which ones, and this goes for me now at the end of residency as well, by the time you know which ones are just preferences that may or may not be of particularly important, you've also learned 10 times as many that are because of something bad as that they've seen before, or because they are thinking about a thing that hasn't even occurred to you yet. So just take them all seriously and learn them all. It's not about making them happy, although that's important. It's about learning how to be a good surgeon, how to be a good doctor. And I think this one's a little better analogy. So fishing for salmon is exactly the same thing, especially these ones. This is called a king salmon or a chinook. Very particular. They only want to eat between 2.5 and 3 miles an hour, trolling with the current. The lure has to be between 3 and 3.5 inches long. The leader has to be exactly 32 inches. The colors they'll eat are only like blue and silver or black and white and green, nothing else. And it's all very particular, and you think, how could it possibly matter that much? But then you don't do it and you don't catch any. It does matter that much. I think that goes for surgery as well. Every little step, every small decision is done for a reason. Maybe not all of them will have catastrophic consequences if not done right, but they all will make the surgery not go as well. I think that goes for our pre and post-op clinical management too. And then finally, I want to shift to thanking everyone, to my co-residents, David and everyone else, to the OR staff, nurses in the ICU and elsewhere, and then to all the faculty. I don't have that many pictures. I've not been good about this over the years. Only one of these is from before the last 2 weeks. So I'm sorry about that. If you're not represented here, it's just because I haven't been good about taking these pictures. And then finally, I want to thank Dr. Ellenbogen. He's been a great mentor. Single-handedly made it happen to allow me to even apply to come to this residency. It wasn't supposed to be possible because of the way that the military GME training system worked, and I will be in your debt forever for that. This has been an incredible opportunity and a great place to train. And with that, I'll take any questions or comments.
Great. All right. Let's get back to Mike's face. Boy, look at what kind of fish did you do? Oh, that was a whale you were pulling up. I see.
Yes, sir. I'm trying to stop the sharing. I don't know why it's not. There we go.
Oh, that's great. That's wonderful. The two remarkable talks, two remarkable young neurosurgeons. I'm excited for both of you because the field is changing so rapidly. It's so exciting. It's so much fun. I just, if only I could start all over again and do it, I would do it again. So questions for Mike? Anything? Remarkable. All right, David, questions for David? Anything? Well, I want to congratulate both of you for your perseverance, your excellence, your growth, and in these talks that really left us to think. And I appreciate you both opening your hearts and opening your personal lives to us. And I want to end just by saying I really it doesn't fall on blind eyes about how hard you both worked with such an amazingly good attitude, and you served your patients well. You did that. You served department incredibly well, and you served yourselves in your academic career. So I want to thank you on behalf of the patients and the residency. So thank you, everybody. Good luck today. Have a wonderful week, everybody. Thank you. Thank you, David. Thank you. Thank you, Mike.